bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Our topic today is endodontics. Here to discuss it with us is the director of the Advanced Endodontic Program at the University of Detroit Mercy, Dr. Michael Hain. Thank you so much for joining us today.
Thank you, Laurel, for the invitation and the chance to talk about endodontists.
Well, what exactly is endodontics and what is an endodontist?
Well, an endodontist is a dentist who has at least 2 years of additional specialty training in working on the inside of the tooth. That's what endodontics is. It refers to the inner surface of the tooth. We deal with the relief of a lot of pain, facial swelling, and inflammation. And we're in the business of saving teeth.
Aside from obviously the increase in education, what makes you so different from a traditional dentist? Because don't they do root canals themselves and treat the inside of the tooth too?
Yes, there's a lot of good treatment that's rendered by the general dentists, and we get involved in the teeth that are a little bit more challenging. Not all the teeth are the same, and some of them technically are very difficult to work in. That's all we do all day long, so we get pretty good at doing it. We have a lot of additional technology that helps us out that might not be in your general dentist's office also.
How would someone traditionally find their way into your office? Would they just have so much pain they'd look you up, or is it typically through a referral situation?
Most of our patients come in by referral, and specifically it's when the general dentist has difficulty or realizes that this is a case that requires a lot of expertise.
Now this is an expertise that I have to be honest, I haven't heard of, but there are very few endodontists out there, correct? And perhaps with that said, more in Michigan than other states.
Yes, there are. We're fortunate we have 2 training programs in the state, one at the University of Detroit Mercy and one at the University of Michigan. There are only about 180 endodontists within the state, and just a little under 4,000 that are actively practicing in the United States total.
You mentioned the technology, and I think a lot of people would probably, frankly, be just amazed by what the dental technology can do today. You see yourself as someone who can relieve pain and save teeth, correct?
That's exactly it. That's our business. We use the latest in technology, both from a computer standpoint and from an imaging standpoint. We use a lot of ultrasonic energy. We're working under magnification almost all the time, either with loupes or magnifying glasses, or most of the work that I do is actually under a microscope. Some of it gets so detailed that the combination of magnification and light opens a whole other world to us. There's a lot of advances in controlling pain and how we get people really numb so that we can keep them comfortable as we work. It's very good. So we try not to work unless we've got people comfortable. We're trying to relieve a lot of the anxiety and the fears and the myths that have gone along with root canal treatment over the years. We've gotten to the point where it's relatively painless, and a lot of folks will comment that they actually have an easier experience than having a routine filling done.
Is this a growing profession? Is this something that you are seeing more and more people interested in doing?
We see a tremendous amount of interest. This is the time of the year when I'm screening records for new potential residents, and it's gotten extremely selective. We literally get the cream of the crop, which is very fortunate from my standpoint. So we have people that are extremely educated and experienced. They've already completed dental school, and most of them have several years of general dentistry experience before they're even accepted into at least a 2-year training program, and then go on to limit their practices just to endodontics.
Do you think most people understand just how important dental hygiene is? Because I know you want to stay in business, but it'd be nice if nobody had to see a guy like you.
Well, that's true, but we're there to help, and there are a lot of problems, some that are trauma-related, a lot of them that are just related to fractures, stress that goes on in the teeth where they finally start to wear out. And we focus in on trying to get rid of that inflammation and get rid of the infections.
Okay, thanks so much for joining us today. Very interesting.
Thank you very much.
Thank you. Today's Comcast Newsmaker was the Director of Advanced Endodontic Program at the University of Detroit Mercy, Dr. Michael Hain.
The preceding has been a presentation of Comcast Newsmakers. Now, back to CNN Headline News.